Hi everyone, I'm Dr. Cesar with ILEA Hair Restoration in Houston, Texas. By now, most of you know that I had a hair transplant back in January, so it's now about 7 months since that procedure. I had a follicular unit extraction, or FUE, of about 2,500 grafts that were taken from the sides and back of my scalp and used to create a new hairline and add density to the top and the crown where I was missing some density. As I mentioned also previously, I had an FUT, or follicular unit transplantation back in 2005, which helped me recover a lot of my hair. But over the years, I had a little bit more receding of my, what they call the temporal recessions, the corners of my frontal scalp here, as well as I had a little patch on the crown that we never addressed on the original hair transplant. So I wanted to kind of bring me up to date to bringing my hair back to a more natural look, and that's why I underwent the additional transplant. Also, as you guys can imagine, I'm in this line of work, so I have to look presentable for the patients. I always tell people you wouldn't go to a restaurant where you see a skinny chef working, so you want to make sure in my line of work that you have good hair, and I'm very, very happy with the results. So let me tell you about the process. So I had my transplant back in January. Initially, the little hairs that are in the follicles that we transplanted fall out, and then it's a wait to about the 3rd or 4th months when you start seeing the new growth. Then after that is just adding girth and density to the hair as the growth continues over time. It's your own hair. It continues to grow naturally just like the rest of your hair. And we take very delicate process, or we use very delicate care in making sure that we make your new hair look exactly like your old hair did, so it is unnoticeable to most people. Because the hair grows out over time, it's also not easily noticeable to other people that you had anything done. I buzzed my hair completely, and then as things grew out, it just kind of looked natural that it was growing out all together at the same time. So in addition to that, I'm also doing what we call medical therapy. So I take dutasteride, which is like finasteride or Propecia that guys take, and I can tell you more about that during a consultation. I also use minoxidil or Rogaine on my scalp, and I take vitamins by LocRx in order to maintain the quality and the health of my hair. So it is not a one shot and everything's back to normal. We can't stop the hair loss process, but we can definitely hold it back and recover some of the loss through the treatments that I've discussed. And frankly, I've been very happy with the results overall so far. I was very happy with my original hair transplant, but we needed to add a little bit more density. I gotten 17 years older since that original hair transplant, and there was a little bit of additional fall of my hair despite me taking medications. But if I would have done nothing at all, basically the top of my head would be gone. It's pretty dramatic how much hair I have now compared to where I was at before I started my hair journey. So please, if you're at all interested in recovering your hair, or medications to prevent the hair loss, perhaps even scalp SMP if you lost your hair but you want a more natural shaven look, or you want to fill in gaps into your hair, please come and see us. We can help you with the entire gamut of hair loss solutions, and not one size fits all. So that's part of the reason for coming to see me for a consultation, is I am going to be able to determine what's causing your hair loss, make some recommendations for you, and follow you along your journey to make sure that you're getting the results that you want. So again, I'm Dr. Cesar with ILEA Hair Restoration in Houston, Texas. Please come see us and let's see what we can do for you.